Bacterial overgrowth and yeast overgrowth can produce similar symptoms, but it is very important that we find out which you have or if you have both, because if you treat one or the other only, you will have partial results and can sometimes actually make symptoms worse. The only way to fully heal is to address everything that is out of balance in the gut. So knowing what you have is very important. If you've been treated by SIBO and gotten partial results, or your symptoms go beyond gut issues, so for example, you may have eczema or skin rashes or acne, dandruff, toenail fungus, vaginal yeast infections, joint pain, muscle pain, brain fog, fatigue, intense sugar cravings, then we may be talking about yeast overgrowth alongside your bacterial overgrowth. The treatments for these are very, very different. So if you're treated for bacteria, you're obviously not going to touch any of the yeast that is present. And if you're not addressing the full picture, you will never fully heal. In the next few minutes, I'm going to compare bacterial overgrowth versus yeast overgrowth, how to identify it by symptoms alone, and how to focus on treatment. If you've done a SIBO protocol and felt better, but symptoms plateaued, or maybe you didn't really even feel better and have more than just gut issues, but more systemic symptoms that we addressed before, then you likely have other things living in your small intestine, not just bacteria. The missing piece might be that you've actually been treating half of the problem. I'm Aneliya, a board-certified PA with 11 years in gastroenterology and holistic gut healing. In my practice, I regularly find that women who plateaued on bacterial overgrowth treatments had unaddressed yeast overgrowth issues. Once we identify and treat both, the plateau breaks. I'm going to compare bacterial and yeast overgrowth across 5 dimensions, then give you a self-assessment to identify which picture looks most like yours. Comparison 1. What they are and where they live. Understanding what we're dealing with is the foundation of everything else. Bacterial overgrowth is bacteria that belongs in the large intestine and has migrated into the small intestine, or may have entered in from the stomach, potentially due to altered digestion, for example, not enough stomach acid. These bacteria ferment foods in a location where fermentation should not be happening. The result is a rapid gas production, bloating, and altered motility. If you have bacteria in the small intestine that produce hydrogen gas that is, you will likely have diarrhea. If you have bacteria that produces methane, you would likely have constipation. SIBO is primarily a localized gut condition, though it can have some systemic effects through malabsorption and inflammation. Yeast overgrowth. Yeast is a normal part of the gut ecosystem in small amounts. When the microbiome is disrupted, yeast can overgrow and become opportunistic. Unlike bacterial overgrowth, yeast overgrowth tends to produce systemic symptoms throughout the body, not just in the gut. Yeast releases metabolic byproducts that affect the brain, skin, muscles, joints, immune system, and energy levels. Bacterial overgrowth is primarily a gut problem. Yeast overgrowth is a whole body systemic problem. That distinction changes everything about how you recognize it. Comparison 2. How symptoms show up differently. Both conditions can cause bloating. However, bloating is very nonspecific. That is where the confusion starts. But the full picture is how you can distinguish the two. In bacterial overgrowth, bloating usually begins within 30 minutes of every meal. Symptoms are closely tied to meal times, especially if the meal has more carbohydrates, because that causes fermentation in the small intestine, leading to the bloating. You may have diarrhea, constipation, or a mixture of both. Symptoms are primarily digestive, although at times you may have some histamine-producing bacteria that can cause systemic symptoms, but for the most part, you are dealing with more localized symptoms in the gut. Yeast overgrowth symptom pattern. Bloating may or may not be tied to food intake. The client has very intense sugar cravings and carbohydrate cravings. They often have brain fog, difficulty concentrating, and extreme fatigue because yeast feeds on iron as well as zinc. Skin issues like rashes, eczema flares, fungal skin or nail infections, dandruff, acne. Recurring vaginal yeast infections or thrush, mood changes like irritability, anxiety, depression, symptoms that feel systemic like something is off throughout the entire body. If your symptoms stop at bloating and digestive upset, bacterial overgrowth is likely what is driving your problems. If your symptoms are more systemic, you have to think yeast. The women who come to me after partial improvement on SIBO treatments almost always have systemic symptoms they've never connected to their gut. They mention the skin issues as a separate problem. They mention the brain fog as just being tired. They mention the sugar cravings as a willpower problem. When I explain to them that all of these are likely due to an yeast overgrowth, it's often the first time anyone has connected the dots for them. The symptoms present differently. The triggers are different too, and understanding them helps you identify which condition is dominant. Comparison point 3. What makes each one worse? Both conditions have specific triggers that aggravate symptoms. Recognizing your triggers helps point towards the right diagnosis. What worsens bacterial overgrowth? High fiber foods and fermentable carbohydrates like the FODMAPs. Probiotics, especially broad-spectrum formulas. Fermented foods like kombucha, sauerkraut, or kefir. Large meals that overwhelm compromise digestion. The trigger pattern is food-specific and meal-related. What worsens yeast overgrowth? Sugar in all forms. Refined sugar, fruit, honey, maple syrup. Refined carbohydrates that convert quickly to sugar. Bread, pasta, pastries, white potatoes, white rice. Alcohol, especially beer and wine. Antibiotics, which kill competing bacteria and allow yeast to expand. High stress and poor sleep, which suppress immune function. The trigger pattern is sugar-specific and immune-related. If fiber and fermentable foods are your worst trigger, think bacterial overgrowth. If sugar and refined carbs are your worst triggers, then you want to think yeast. I ask every new client about their relationship with sugar. The women with yeast overgrowth describe cravings that feel out of control, almost addictive. They feel like they cannot stop eating sugar even when they know it makes them feel terrible. That pattern is not a willpower problem. It's an yeast problem. The yeast is driving the cravings for its own food source. Different triggers point to different conditions. The next comparison is critical. Why treating one like the other makes both worse. If you are realizing that yeast overgrowth may be your issue, then hit subscribe. I release videos every week helping you identify and treat your gut issues. Now let's talk about why the treatment distinction matters so much. Comparison point 4. Why treatment is completely different. This is where the real damage happens when conditions are misidentified or only one is addressed. Treating bacterial overgrowth. Antimicrobial protocols targeting bacteria like herbal antimicrobials or specific antibiotics like rifaximin, low FODMAP or similar diets to reduce fermentable substances during treatment, prokinetics to improve gut motility and prevent bacterial migration back into the small intestine, digestive support to improve breakdown of food in the upper GI tract, treating yeast overgrowth, antifungal protocols, herbal antifungals like oregano oil, caprylic acid, and berberine, or pharmaceutical antifungals. Low sugar, low refined carbohydrate diet to starve the yeast. Biofilm disruptors. Yeast often hides in protective biofilms that might be broken down for treatment to reach it. Immune support to help the body regulate yeast populations long term. Die-off management. Yeast releases toxins when it dies, which can temporarily worsen symptoms. What happens when you treat the wrong one? If you treat bacterial overgrowth but you only have yeast overgrowth, obviously you will have absolutely no improvement. If you treat yeast overgrowth but you have bacterial overgrowth, same thing, absolutely no improvement. But if you have both and you only treat one, which usually bacterial overgrowth is the most commonly treated, whether you work with holistic or conventional medicine practitioners, you will have some improvement, then you will plateau. And then usually symptoms come right back. So knowing what you have and addressing it correctly is the only way to fully heal. I worked recently with a client who had been treated 3 times in different ways by different practitioners for SIBO. She would improve slightly and then symptoms would come back shortly after. She never fully recovered. She also had systemic symptoms like the one we talked about with yeast overgrowth. When we tested her properly and identified what exactly was living in her gut and placed her on a protocol accordingly, all of her symptoms went away. In order to fully heal, you have to know what is actually living in your gut. Treatment must match the condition. The final comparison gives you a self-assessment to identify which pattern fits you. Comparison 5, the self-assessment. Which pattern looks most like yours? Work through these honestly. This is about identifying your pattern so you know what to investigate. Signs that point towards bacterial overgrowth. Bloating beginning within 30 minutes of eating. Symptoms are primarily digestive, bloating, gas, diarrhea, or constipation. High fiber foods, legumes, and fermented foods are your worst trigger. Probiotics make symptoms noticeably worse at times. Symptoms are closely tied to meals. You don't have significant sugar cravings or systemic symptoms. Signs that point towards yeast overgrowth. Intense, hard to control sugar and carb cravings. Brain fog, difficulty concentrating, mental sluggishness, fatigue that does not improve with rest, skin issues, rashes, eczema, fungal infections, unexplained acne, history of recurrent yeast infection or oral thrush. Symptoms feel systemic, affecting your whole body, not just your gut. History of frequent antibiotic use. Symptoms worsen with sugar, alcohol, or stress. Signs that suggest both may be present. You have digestive symptoms that respond partially to SIBO treatment plus systemic symptoms that persist. You have both food fermentation triggers and sugar craving patterns. You've had improvement from one type of treatment but never full resolution. Your symptom picture is complex and doesn't fit neatly into one category. Answer these 3 questions. Are your symptoms primarily digestive, or do they include brain fog, skin issues, fatigue, and sugar cravings? Are your worst triggers fermentable foods and fiber, or sugar and refined carbs? Have you had partial improvement from treatment that eventually plateaued? If your symptoms are primarily digestive with food fermentation triggers, prioritize bacterial overgrowth testing. If your symptoms are systemic with sugar triggers, prioritize yeast overgrowth testing. If you have both patterns or partial improvement that plateaued, this is more common than most practitioners understand. Bacterial overgrowth and yeast overgrowth are different conditions with different symptoms, different triggers, and different treatments. The overlap in bloating is where the confusion starts. But the full picture is distinct when you know what to look for. The women who stay stuck longest are often those with both conditions who have only been treated for one. Full healing requires identifying everything that is out of balance and addressing it in the right sequence. That investigation is available. The testing exists. And once you know what you're actually dealing with, the right protocol becomes clear. Now that you understand what may be driving your symptoms, the next step is knowing what to do about it. I made a video walking you through the 5-step protocol that I created to treat your gut comprehensively. The sequence that makes the difference between staying stuck and finally getting better. That's the one to watch next. It is linked on the screen now.